Thank you. Helen Biggins from Seniors Together in South Lanarkshire. You're obviously very aware of the new legislation that's going forward on the integration of health and social care, but Seniors Together, through, thankfully, SOPA, have been representing older people and making representations to several MSPs over the last few years. And what we were trying to point out, Rona, was that older people should not be represented by that third sector interface that you're speaking about. And that's what has happened. In the legislation, if you look at it, the community representation part of that legislation is for the community to be represented by someone from the Public Partnership Forum, someone from carers, and someone then from the third sector. No mention still of older people. Now, we point out to them that older people should not be represented by the voluntary sector. Older people are not volunteers. Older people should be given the voice that they have. They know how to speak for themselves. They don't need that third sector interface that you're talking about to speak on their behalf. And what we've been asking for years, and we were asking again at our group today, was that older people should be given the opportunity to design their health and care themselves. And that's all that the legislation makes provision for. And what we were saying was that should be enshrined in the legislation, that older people should be given their own voice and given a position at every level of the operational management part of that integrated service. And we still haven't got it, because when you ask about it, they say, oh, it's not in the legislation. Those other three groups of people are legislated for, and yet after all we have said over these last few years, that has been ignored. And we're asking you once again, would you try to ensure that older people are catered for within that legislation, so that we can justify the fact that you want us to have a voice as well as wanting a voice for ourselves.
I absolutely agree with you. I think this was arguments we had when we were putting the legislation through. Who was actually going to represent the needs of the service user, for want of a better phrase, be they an older person, be they someone needing care and the like. And the difficulty was, and I suppose my difficulty with the third sector interface was that sometimes third sector organisations are representing service users. So we were trying to be very clear with the legislation that it wasn't they represent service users, but they also represent service providers, and I feel there's a conflict there if the third sector are representing both. And one of the things we were making very, very clear during that process was that the third sector that was going to be part of those new boards had to be representing service users, not just service providers. I think that's really important.
I think Ruda's absolutely right in terms of it's an acknowledgement. I suppose one of the difficulties, and I come back to maybe one of the things I said before, was the person-centred approach. Because do we have older people in isolation in terms of, is there such a thing as a group of older people? Or is there a group of older people who have particular conditions, whatever that condition is? Because, and I think this is where we have some difficulty, not just as parliamentarians, but I think certainly in the committees. We're trying to ensure that we cover all sectors of the population, and that in itself can be very difficult. Now, the third sector, I think to some extent, the third sector can have a voice, but that third sector has a voice for what? Mental health, for young people, for people with drug and alcohol, for people with sensory impairment, for people with dementia, people with, you know, a multitude of conditions. And perhaps maybe it's not the vehicle for older people. And I think what we need to establish, and what I probably need to be very clear about in my own head, is, do we have a group of older people who say we want to be represented as older people, not older people with particular conditions? Because I think one of the problems we had, and I experienced this before I became a parliamentarian, was when we had representations from older people themselves, some of them wanted to talk about their particular experience, and that was maybe coping with a relative with dementia, or coping with someone, or even in their own conditions with maybe mobility problems due to chronic arthritic conditions or something. So what I'm saying is, if we're having a group to be represented and a voice for older people, we have to be sure that whoever is making that representation on integrated boards, for instance, is talking about the generic older person rather than a specific, you know, condition or group. And I think that's a very important thing. So perhaps you can help us in actually identifying that generic approach rather than the specialist approach, because that's sometimes where we fall down.
I have to say that I'm on the Edinburgh Older People's Joint Management Group, which is a sort of subsidiary of the Joint Integration Board, but it's only for older people. Now, everybody on that board, there's only 2 lay people. And everybody on that board, every voluntary sector that you can think of, every group with their own interests have a say. And the only 2 people that don't are the 2 lay members. And we're only supposed to be there to observe and take it back to other groups to tell them what they're doing. And lots of times we disagree with people in the voluntary sector, and you're actually shouted down. I'm telling you that. You're actually shouted down. And if you want to ask me about what these factors, things that they were, I can tell you afterwards. I'll not necessarily go on with it now. But it's just to say that we have no say whatsoever. But the voluntary sector in Edinburgh has a big, big say. And they get a lot of money from the council. And they're not accountable for actually whether it is actually value for money to the taxpayer.
This is music to my ears. More lay people at this level of decision is very, very important. Any other question?
Sam Gibson. I haven't paid too much attention today to the integration of health and social care, but I've been interested in other topics. But I've been thinking about it, listening to the discussion, and something came into mind. And that is something maybe to consider, and that is the old medical social worker who was actually based in the hospital, and I found them to be particularly effective. They knew everything about the medical conditions that people suffer for by observing them in the hospital. They were with individuals. They were in constant touch with their with the medical staff, actually the surgeon or the physician who was treating them, and acting and liaising with the carers or the relatives as well. They did a really good job. They would organise things like appropriate level of housing or whether a person could go home safely. Analysing their needs, and had private talks with the actual patients themselves, separate from talks with relatives and carers. So they really they had a lot of experience about the medical conditions, and could pinpoint accurately where things could be improved and actually obtain changes in housing, like sheltered housing, or the old type of hospital where if somebody needed to be permanently hospitalised, they didn't go to a geriatric ward in a general hospital. They went, they were still under the health authority, but they went to these hospitals, and people lived in this type of environment a bit more happily. So I'm floating the idea of the old medical social worker again. I don't know why they disappeared, if it was cost cutting, but it's an idea to consider them in your new system now that you're jigging it back together again.
Very good idea. Any other very good ideas?
Okay, I'll just take Mr. Gibson's point there in terms of the social workers within the hospital. This is part of the whole aspect of the health and social care as well. And many hospitals, especially many of our larger hospitals, actually do have social work teams based in the hospital. And that's primarily to ensure that, again, I go back to this person-centred approach, to ensure that if a person is leaving hospital, that the appropriate care or the appropriate conditions are there for a person going home. But one of the things we're actually trying to do is prevent people going into hospital. There's far too many people going to hospital who, in some respects, could be prevented from going, and that's to ensure that the appropriate care within that community is there for people. And sometimes, without going into hospital, maybe trying to get the appropriate medical and social care they need within their home, because that's where people want to be. Not many people I know want to be in hospital.
One of the subjects that's not been mentioned yet is volunteering. The third sector volunteers. As a 75-year-old gentleman, and I've volunteered ever since and before I stopped work, but mainly since I stopped work and retired. What I would like to know is, where do we draw the line in the sand when it comes to asking us to do, with due respect, your job? We have worked from 15 in my case till I was 65 years of age. I would have thought by then it was my turn to put my feet up. But because of my social upbringing, I felt that I need to contribute something because it's not being done by the people I was hoped was going to be done. I'm more and more dealing with pensioners groups that are asked to volunteer for this and asked to volunteer for that. Now, I know there's a financial problem, but I don't think it is unfair on any government to put the strain on our age group that's being put on at the moment, and we feel that that drawn in the sand has been drawn, and you've got to realise we're no chickens anymore, and we can only do so much, but we feel there's more and more being put on us.
You were talking there about the integration. One of the big things that's missing, and I think you have to take cognizance of, is the joined up writing. It's okay to keep to have things going together so as we can keep us out of the hospital. But the joined up writing side of things is we've got integrated health and social care, but we've got councils that are shutting down services that the senior citizens use. And I gave the example in a group I was in where in Irvine they're shutting down the Magnum Leisure Centre. It's got a massive indoor bowling group that are mainly pensioners. Now what are they going to do? They've nowhere to go. They're building a new leisure centre that will not cater for them. So and again, they talk about the obesity crisis, and what they're saying is that the Magnum's too far to walk to. It's 10 minutes down the road. There's a lot of joined up writing that needs to be looked at. Libraries, people are saying that libraries now are getting shut. Older people use libraries, and they're not taking that into cognizance. If they do, then that'll be good. But I think more emphasis needs to be put onto that.
Just on those last two comments about volunteering, I think you're absolutely right, and I think if it wasn't for older people volunteering, lots of communities would really be in a difficult place. Certainly the folk I was speaking to this morning at Boleskine Care, all the carers they have working for them are into their 50s, and they're hoping they'll keep going into retirement because it appears to be older people looking after older people. And those are paid jobs, but at the same time it's older people doing them. And again, you know, you look at local government services are being cut, and the services that are not being cut are being charged for. So you're finding people are having to pay just to get very basic services in to help them, you know, stay at home and be independent. And again, you know, self-directed support was set up to allow people to be to actually design their own care, but you find an awful lot of the time, certainly my constituents are being told that's not available under self-directed support. And the next thing, which actually isn't right, but people don't know that they can stand up against that and say, no, I can use this because this actually keeps me independent, keeps me living at home. So there needs to be more advice and more advocacy out there to stand up against, I guess, vested interests who will stop people using those things to get their independence.
We'll maybe take a free contribution and question together before we get answer from Dennis and Rhoda.
NPC Scotland. And I'd just like to ask the three MSPs if they've signed up to the NPC Dignity Code. And if they haven't, why not? And if they have, I'll applaud them for signing up. And I'm just wondering if SOPA has signed up to the NPC Dignity Code, because they should do.
So, Bill Johnson, Chair of the Scottish Seniors Association and SOPA committee member. I think Dennis Robertson posed a very important question to us, is how would he as a parliamentarian and his colleagues actually know they were talking to a representative body of generic older people? And I think that's something SOPA will need to discuss over the coming year. But what I'd propose and suggest, and I'd like to hear from the MSPs, that would help that process of getting older people engaged in the kind of democratic renewal of the New Scotland would be to have some sort of focal point for it. What we hear about all the time is specific issues which are dealt with by different groups, different people, different professionals. We all know that the demographic trends are moving steadily north of 60. And that's not just a Scottish thing, it's worldwide. And we're going to have to deal over the next 10, 20 years with a much larger over 60s population. I'd like to ask the question of the MSPs, is it not now time that we actually had an open debate and a proper strategy for ageing in Scotland? And no more, no, well, not no more, we have to keep going with what we need, but no longer simply sticking with a bit of work on disability, a bit of work in the voluntary sector, a bit of work in the hospitals, integrating healthcare and social care, but actually looking at the whole picture of how do we manage ageing in an ageing population, despite the fact, you know, that there are many people who would want to split us up and split us off from the young people and so forth. But I'd like to hear from you. Would you propose and take forward that an idea in the Scottish Government, a strategy for ageing for Scotland? Thank you.
My name is John Parkhill, representing Strathclyde University in Glasgow's Senior Students Association. Two brief comments I would like to make, please. I came here today very ignorant of what joint integrated health boards do, but I intend to learn more from now on. Dennis Robertson asked that he wanted to be aware of who the generic older person is. The comment I would make regarding this, and it builds on what Bill Johnson just said a moment ago, is that a statistic I learned recently is that there are more people aged over 50 than there are under 18. Now, I have nothing against young people because I once was one myself, but I would welcome your comments on that, please.
Perhaps, you know, I mean, I think this, looking at the sort of what strategies we have for ageing is an important one. And it's at which point in our lives, taking on your last point there, is when do we start to age? I certainly sometimes feel it, but I still think I'm quite young. And the good thing about, for me, is I don't look in the mirror anymore. But apart from, but what I am saying is, I think, in all seriousness, I think we need to look at maybe the whole aspect of how we look at the strategy for ageing and how we actually do a joined-up approach. Because it was mentioned, you know, there's not this joined-up aspect in some respects. And I agree with you. And everything is sort of separate. And we do focus on separate groups sometimes. There's nothing wrong with that, can I say? Because I think we need to be aware of the needs of particular groups, and we need to be aware of how to provide the appropriate resources for particular groups, and certainly in specialisms, and understand, because we need an understanding. But I do actually like this ageing sort of approach and this sort of generic aspect of what actually impacts on maybe all people who are aging, and how do we address those factors. So yeah, I'm very interested in that. With regard to the NPC, can I just say that I'll look at it, because I would need to, and it's about signing up for any. Rhoda and I probably get involved in signing up for many things. If I haven't, I shall certainly look at and hopefully even come back to you. Probably get your name before we leave, and I can send you an email with the most appropriate response, and hopefully we'll be able to do that at the end of the meeting. Thank you.
I think, yes, on the strategy, yes, we need an older people's strategy. But I think we also have to recognise, and what is very clear to me is that older people are not just one mass. There is hugely different needs and wants, and it's about how you deal with age discrimination, ensuring that older people get to live their lives the way they want to live their lives, not as older people, and not shut them away. Older people have to be empowered to play their full part in communities, be heard. And certainly I would say politicians do listen to older people, because older people tend to vote, and that's the most powerful tool you have in influencing older people. So use it by all means, but also look at ways of how we, and again, going back to the things about online and stuff, how we can communicate better and hear better, because communication is a two-way street. How we can hear the needs of what people want and where maybe we're not listening. And I think that's coming out loud and clear about integration of health and community care. But there are other things we maybe need to hear more from older people, and how we actually do that and allow people to speak. Because we're guilty of doing things online as well, because it's quick, it's easy, it's cheap, you don't have to post anything. And that does lock out a lot of people's views and thoughts.
Thank you very much for that, Rhoda. Maybe one or two questions to close up. It'll be the last ones.
It's more, sorry, it's not really a question, it's just a comment. The group that I run, the age range is from 60 to 93. That's my oldest lady that comes. And picking up on Dennis's point about the difference between generic and a specialist approach, what I've noticed is that although I just relate to everyone as a human being, not an older person, it's human beings with human needs, whether they're over a certain age or whether we're all similar, even though we're different. And it's the needs to belong, to be valued, to be heard, to be listened to, and to be understood. And I think that as much as we're all very different, we are all very sort of similar in our human needs and conditions, and to be loved. So yeah, I would just say that treat people as human beings is the best thing.
Thank you very much.
Thank you. While I offer full respect to the gentleman at the front for his 10 years of volunteering, I'd like to offer the alternative philosophy. There are 1 million pensioners in Scotland, all of whom have got 40 or 50 years professional experience in something, whether it's builders or bankers, painters or professors. And most of us can expect 10 years of vigorous life before we start crumbling at the edges. And yet at a time of fiscal shortage, government in its widest sense is spending millions of pounds on consultants, all of whom have got less experience than their retired colleagues. Is there not some way that they can actually use this? Is this not like someone with an untapped oil well in his back garden pawning his shoes to pay the gas bill?
Very good point.
I'll try and be as brief as possible, Christian. With regard to the volunteering, and my apologies for not mentioning it in my last comments, I think it's really important. One of the things that strikes me is, I think for many years, volunteering isn't new. And there's maybe we hear more about it because perhaps there is more need in some respects because more people are living longer. But, volunteering, I remember, when I was a young cub, a young scout leader, I was always volunteering, even as a young person. And I think it's maybe in our blood to some extent and I take your very, very well-made point about, we're all human and we all need respect, we need love, we need listened to. And I think these are all qualities that we should be looking to. We acknowledge volunteers, and I think that we should acknowledge people who volunteer and who provide an essential service. And we're seeing more and more of that within the kinship caring and various other things. There's probably going to be a greater need for volunteers. And I think the point was well made that perhaps it is time we listen to those with the most experience, from instead of paying maybe vast sums of money sometimes to external consultants who are doing research and no, I'm not really making an apology for people at university doing research here, but what I'm saying is that sometimes we don't listen to the people that actually do know what's been going on, what has happened, what needs to happen, and perhaps it's a point well made, and perhaps we should invite you along to one of our meetings.
I get the point about volunteering, and indeed some of the burdens I think that fall on older people. I mean, I speak to friends who have retired who say they've never been so busy since they retired because they're running around doing everything. But there are things that we need to help people with. For instance, kinship care and caring. You find that older people are more responsible for bringing up children than they were bringing up their own children. They seem to be more responsible for grandchildren at the same time as they may be looking after very elderly relatives as well. So we need to look at how we support people. Yes, by all means, encourage and enjoy volunteering, but when it becomes so difficult that people are exhausted, then that's not good, and people need that kind of support. And you know, volunteering is part of supporting that, and I think people do it very well, but everything in proportion, because you know, as someone said, you've worked all your lives, you want to enjoy a retirement, especially when you're healthy. You want to do some of the good things, and I do have other friends who spend a lot of time volunteering and the rest of the time on holiday, so I'm quite jealous of that. So a good mix, work-life balance, I think, is what we're looking for.
Could I just congratulate SOPA on having raised the question of funeral poverty, and you'll have heard the Cabinet Secretary referred this morning to the launch of a review of that. I'm the named person who's conducting that. I am retired, I am an older person, I'm also a consultant, so I don't quite know where I sit on that spectrum. But can I just extend the invitation I gave to our group this afternoon? If anybody present would like to make comment to me about issues around funeral poverty, I would be happy to give them a card as they leave today, and they can contact me and we'll take their comments on board.